front desk. And a lot of people who work the front desk in a school-based health center say that they have to they have to fill so many more roles than they do in a larger health center where there'll be separate people for all these different roles. And so we would like to convene a meeting of some training for the front desk folks who are also they don't come to our conference because they're not, as well compensated, and they also don't really have a professional association. So that would be my dream project. And since this is something where I'm guessing people have to think of things, I just want to leave it open for someone to jump in and go next. And say who you are and where you're from.
This is Tammy from Oregon. Of course, I had something spring to mind right away. This is something we would like to do. We would like to host a summit of all of our past and future funders and get them together, because all of our foundations in Oregon are going to very community-based focused funding, and that's just not something we can do, but they like our work. So we want to bring them all together like we did many years ago with Terry Wright and say, SPHCs, the Alliance, you got to back it. We still need state-level policy work being done, and so we would love to hold a big summit.
Awesome. Okay, so who else has a project?
This is Debbie from Colorado.
Oh, hey, Debbie.
And I just had this happen to me yesterday, actually.
Oh my God.
Seriously, it was the amount of money is unknown at this point. I suspect more than $20,000. But this funder would. We decided that they would give us some money to establish a patient assistance program for uninsured adolescents who want a long-acting contraception and can't afford it. So this funder would give us money to put in a bucket, so to speak, to pay for long-acting contraceptive methods for any adolescent who comes to a school-based health center. Most of ours offer LARCs, especially Nexplanon, and then we would, out of that fund, pay a certain amount of money for their Nexplanon and insertion.
That's really cool. Keep us posted on whether that comes to being and how it goes.
This is Nancy in New Mexico. I would love to have a mini grant program for our school-based health centers to apply. We have more than 60, so $20,000 wouldn't go super far, but maybe $500 to $1,000 they could apply to do a project to make their clinic more youth-friendly, and there would have to be a youth engagement or student health group participation for them to be able to get the money, and it would have to be based on the patient's feedback. Partially because we have in our strategic plan to work with do youth engagement, and we never do it, and secondly because we need to better connect with all the school-based health centers out in our state so they can see us as a real true advocacy organization. So I think that spreading a little money around to the clinics directly would really help with that. But now that I've heard other people's ideas, I like those things too.
Thanks, Nancy.
This is Heidi from Illinois. I would say I've heard from the field that they find the work that they do while they're very passionate about it as a really isolating kind of experience because of their size. They're within larger structures that they're not exactly an integrated part of in some cases, in most cases. And so I've been toying with the idea of trying to find funding to start an infrastructure to support something like learning circles or groups that, would meet across the state to help them come together in more organic forms than our current regional meetings and our current more formal conferences and that sort of thing. So some kind of infrastructure to support networking and sharing of best practices for the different roles in the clinics across the state.
Heidi, this is Serena. Get in touch with me about that because we've been doing a ton of that. Yeah.
Awesome.
Cool. Who else?
This is John.
Kathy. Go ahead.
Go ahead, Kathy. I've listened to a lot of the ideas, and all of them are great. And something similar to what's been mentioned, I think having funding to be able to offer education to providers and to support staff, because Serena, as you said, our front desk provider, or our front desk staff are really, they have a lot on their desk, so to speak. They have a lot of tasks, and they don't always get the education that they need to be up. And providers too, giving them access to a variety of training would be good and help them be more updated.
Great, thank you. John?
If I had that opportunity, I'd like to use that money for spending more one-on-one time with the centers and educating them on where they're missing out on revenue maximization in their billing process.
Good idea.
Yep.
This is Nicole. Just following up on that, I think our request would be around sustainability and infrastructure for school-based health centers, and how to get do some convenings and some outreach to existing centers, as well as jurisdictions that do not have school-based health centers currently, to get an understanding of what they need in order to either launch or sustain their current work.
Great, thanks. That was Nicole, right?
Yeah.
Okay.
This is Ruth in Atlanta. Sustainability, of course, is key for us, and since we're new, we have never hosted a conference for school-based health centers in our state. We're up to 12 at this point, and I would envision using that money to fund a conference for them. And we would also be talking about, as John said, sustainability and maximizing billing and any other issues that come about, some training for the staff too.
That would be great. A conference is a great way to launch, I think. So Nicole, Kim, Nancy, Marilyn?
Yes, this is Marilyn from Ohio. And one of the things we've talked about needing, and we did a meeting last week where Ohio Public Health Association hosted us, and we just had a 4-hour session that we spent a lot of time just talking about goals and growth and educating each other about what's going on in different parts of the state. So you can't, it costs a lot to have that many people drive to one location. So what we had talked about doing is, I think it's called the Blue Jeans webinar. So kind of everybody gets on a webcam, and so you have this whole desktop full of webcams for the people that are participating, and it's a sharing session. So that's what I think would help us to have the growth, because that's what we talked about. It's, how do we meet the goals that were lined up in Austin? So having us be more, an easier way to meet together as a state.
Great, thank you. And Marilyn, I don't know if you heard the structure, but I was saying if you had $20,000, so if you had $20,000, maybe you could do it in person.
Well, or maybe we can do it every month and make it short.
Yeah. Okay, thanks.
You can't, you have to pay, if you pull people for, that's like a 4-hour trip for us. So you take all our salaries times 4 hours, that's a lot of money gone.
Yeah.
It's not about paying for it, it's about pulling staff out of the centers. So if people could just, on their lunch break, get on a webcam and talk to the rest of the people in the state, you got to think about the cost in terms of what it costs to pull people out of the center.
Right, yeah. Okay, Nancy, Kim, or Nicole?
This is Nicole in Arkansas. The first thing that came to my mind was creating some sort of educational opportunity for the Arkansas School Board Association. That association writes a lot of policy for us for school districts, And when we look at these collaborative partnerships, we've got all of our healthcare people that understand HIPAA and have all their lawyers ready to go, but I feel like our school board associations aren't well educated about how to partner with medical organizations and how to write policy that's, good for both, and looking at expanding school health services. So I feel like some sort of educational opportunity for them would be really helpful.
Yeah, that's really interesting. Thank you for sharing that.
And this is Nancy. I already went, actually, so.
Oh, right.
And I'm in New Mexico with Nancy, but I think the only thing I would build on, I like the youth engagement idea that she brought up, but potentially adding in male-friendly services in our school-based health centers.
Oh, yeah.
So.
Yeah. Okay, so the only person I didn't check off was Kim, but did I miss that?
That was me just now.
Oh, that was
New
you.
Mexico
Okay.
With Nancy,
Okay.
so,
Great.
Yeah.
Awesome. Thank you, everyone. So I think we're now on to the committee updates. And Marcel, are you on the call? Okay.
Yes,
Can we go on to? Oh, you are. Okay, great.
Thank
you.
Yes, I am.
Okay. All right. So this is all. We're all still kind of figuring this out. So I guess at this stage, the idea is that the committees, which haven't actually mostly met yet, so this might be very brief, are doing an update of what they're working on and or any input that they want from people or any activities they want from the whole group, or anything. So basically it's the time to share and get input and do whatever it is that the committee wants to do with the full group. So Marcel, I actually don't know. I don't think any of you have met Marcel, but he is our communications manager, and so he is chairing the communications committee. So Marcel, do you guys have things to share or ask?
Yeah, so I will just let everybody know that our focus for this committee and our focus for this work is really trying to come up together with some education messaging and with some messaging about the value of school health for an education audience. So we're going to be looking at how we have been talking to this audience and what kind of messages we've been using and trying to come up with some statistics and some messaging that all of us can find useful. So if you have, if this resonates with you and if you have things that have worked well with you, you can always email them to me, and you can always bring them to my attention. But we're going to be doing this on our committee call, and we're going to be having that from 10 to 10:30. So those of you who are on that committee, we're going to be talking more in depth about that on our 10 to 10:30 call with Kyle. But I welcome you to reach out to me if you are interested in this, if you have any insight about this, or if there's anything that you want to know more about, or if you have information that, or data that you've been using or messages. And you can email me at mreynolds@schoolhealthcenters.org. It's MREYNOLDS@schoolhealthcenters.org.
Marcel, this is Nancy in New Mexico, and I think I fell off my duties because I'm supposed to be on your committee, and I am not aware of when the meeting time is. So explain again what you mean by 10 to 10:30 with Kyle, and what day and what time zone and all that.
And actually, let me just pause and ask Serena Reckling and just confirm that we are doing that. Are we doing that today? Serena, are you there?
Sorry, I muted myself. I think what we were going to discuss, and that's agenda item number 3, but maybe we can talk about it now, Serena, what you and I discussed, but we were going to introduce that concept today, and then moving forward, starting September, actually implement it. So do you want to talk about that right now, Serena?
Oh, I thought what you and I discussed was that we were going to use separate call-in numbers and just have everyone hang up and call in at 10. Because we talked about it, so Nancy, you might not have been there, but I actually think this might have been your idea.
You're at 10 o'clock your time, right? Okay.
Right. So yes, 10 o'clock our time. Right. So basically, we were going to take the last half hour of the standing call and devote it to committee conversations. So we would break up into breakout groups, so to speak, so that we didn't have to schedule yet another time on our calendars. And we talked about that. I actually really do think this was your idea, Nancy. But
yeah,
it was a great idea.
If it was an extra call, if it was just
yeah, exactly.
So yeah, that's
so we
perfect.
thought we'd give that a try. And so I guess I don't know if we're going to try to do that today or not. I mean, maybe Serena and I got our signals crossed. But I thought Serena had a fancy technology that she thought she could use that would actually like break us up. Like literally, we wouldn't have to hang up and call in again. But I think it wasn't working flawlessly, and we didn't want to drag everyone through a ton of, technical issues. So I thought today we were just going to hang up and call back, but maybe if we don't have that prepared, we'll just have to do that in September.
Yeah, I think, so just so everyone on the call, we have these committees that are meeting, and instead of, because we are already meeting once a month and we have this hour and a half dedicated, that the last half hour of these calls moving forward, starting in September, that each one of you can choose which committee you want to be on and call in. We're going to create separate free Conference Call America phone numbers for each committee. And then starting September at 1 o'clock, you'll have a half an hour to meet and convene. And so that'll give an opportunity for everyone to participate in at least committee conversations rather than having to commit to a separate meeting on a separate time. And we were going to start doing that in September. At least that's what I had thought, because today's call agenda is a little packed to do that today. But are there any thoughts or reactions to that idea?
I think this is Kathy from Delaware. I think it's a great idea. It's a good way to use the time and to not have to add another meeting to our schedule. So I support it.
This is Heidi.
Tammy, I'd say ditto to that.
Yeah.
Nicole, I agree.
Great. So I can give brief updates about telehealth and NQI, since these are kind of part of a larger initiatives that are happening here at the office. Telehealth, I am meeting with Laura Bray and the telehealth folks that did the pre-conference that I know some of you attended for a brief amount of time. So we're having an internal meeting next week to discuss our work and engagement moving forward, especially as it relates to state affiliates. So hopefully on the September breakout call, I'll have more information to share, and we'll have more to process in terms of how we feel we can work together as state affiliates on that work. And then NQI, there is a lot of momentum happening right now in terms of figuring out what the learning collaboratives will look like and what the content is. So I think there'll be some room to use you all in these committees to do some brainstorming and thinking around specific areas that we're tackling. So more on that next month as well.
Okay, great. Thank you, Serena. I do just want to clarify, though, that these are committees of the state leaders in partnership with the national organization. So if there's something that the state leaders want to do that is different from or in some way adds to the national work, that I think we should try to create space for that. So I mean, obviously we don't want it going in a separate direction, but I want people on the call to feel like this is their committee, that they can make sort of separate decisions about what's the most important thing from the state perspective.
Absolutely.
And I know that Ruth is the chair of the telehealth committee, but I don't know who's the chair of the NQI committee.
Hey, Serena, this is Tammy. So when we met that day, our committee did not identify people as chairs or co-chairs. We wanted a little bit more explanation as to commitment, process, et cetera, et cetera. And so we haven't moved on a committee, and I'm feeling like it's very much adrift and that we need to establish that.
So I think that, just to recap where this all came from, we had our meetings in February, we did a lot of brainstorming, we put a ton of paper up on the wall, We ended up voting on top priorities of things that people wanted to work on, and I actually feel like this shouldn't be called NQI because that really puts it like squarely in the camp of the project of the national organization. And I'm not sure if I'm going to express this correctly, but I bet that the facilitator, if she went back to all of those pieces of poster paper, could find the exact words that we were using. But it was something about quality standards or measures or school-based health center. I don't think it was definition because that was a different thing. And so that's how we formed the committees. So I think that everything is really up to us, like in terms of the time commitment. I mean, it's really just the committees were to establish some kind of goal so that we would feel like by next June we had like moved the ball forward just, you know, in some way that we would be able to like work together to make something happen that was beneficial to all of us. So I really think that that's up to all of us, like how much time, what is it, what makes sense, and so forth. I think what Serena and I were trying to do was just sort of set up a structure so that this could work, because we've been talking for so many years about how this group functions together vis-a-vis the national, and I know a lot of people are new, but just so you know, like it's not, this is a pretty normal problem I feel like that groups have, so I don't think it's anything super negative about us as a group. It's just been challenging because we're all so far apart, we have different issues, but yet at the same time we feel like there's a lot of value that in working together, because there's a lot of reinventing the wheel that can happen, so why not try to bring this all together? So anyway, Tammy, that's a long way of saying I think it's up to you guys.
So then, hey, should we just, the process to go forward then is potentially revisiting with the people that were attended that day and saying, let's just get our act together, and how do we want to do that?
Yeah, and I think that, again, this is all very formative. I feel like it's probably going to be a different group of people that are going to call in when we actually have the call in September, so you're going to have to grapple with that, because, I mean, that's just going to happen. There were people at that meeting who don't participate on these calls, and vice versa. So I would say yes, but it might be a different group. I think the committees are going to be whoever shows up that day, but it would be nice if we all had a guiding goal so that even if it's different people, we know what's the goal of the committee. And I think with the one on quality indicators, it's a little bit more further complicated by the fact that the national already has an initiative. So then it's figuring out how is this committee going to relate to that national initiative. But I mean, I'm really trying to promote the idea that it's not just about like waiting for national to tell us what to do.
Yeah. Okay. So go back to the February note.
Oh.
Yeah.
So sorry.
This is Ruth.
Yeah, go Ruth.
Yeah, this is Ruth, and I just wanted to say that the last communication I'd had with Laura, who apparently is a staff person, you know, so assigned to this telemedicine initiative, I guess this Laura and Serena. Okay, and you know, she was waiting on some notes, I think, from the telemedicine group that met pre-conference, but she's aware that, you know, we, you know, have our own committee, and, you know, we're trying to figure out best ways to work together. So I guess I was surprised that I hear something's happening next week. Please keep me informed.
Oh, yeah. Yeah, Ruth, let me shoot you an email offline. My complete apologies.
Okay. That'll be great. That'll be great. Thank you.
Okay, so Tammy, do you feel like you got an answer to your question?
Absolutely. I think I'm just going to go back to the February notes and recapture some of that stuff, and I'd be happy to, you know, do an invitational email to people to see who wants to sort of form and storm and norm around this and move forward.
That's great. I really appreciate you stepping up that way. It sounds like you're sort of maybe the chair.
Temporarily.
All right, let's go with that for now, and then we'll see how that evolves. But that would be super helpful, just to have kind of a point person who's moving that forward.
Serena, okay. This is Stephanie from Serena. This is Stephanie from North Carolina.
Hi, Stephanie.
I just have a follow-up question. So it seemed like there was another subcommittee around NQI that involved a few of us. I think maybe Marilyn and myself and maybe John and 2 or 3 others were supposed to be some sort of a subcommittee to the National Quality Initiative work. And I know we tried to have one call, and I think maybe Marilyn and I were the only 2 that jumped on the call for that day, and so we tried to reschedule, and then we ended up meeting at the national conference in the larger group, which involved many more people. So I guess I'm kind of wondering and wanting some clarity around, is there a subcommittee of us, of state affiliate leaders that help to inform the National Quality Initiative, and then is this other committee that we're talking about separate, and then do they connect at all or interrelate? I'm just kind of wondering.
Okay, so I'm gonna let Serena Reckling answer that, but my sense is that this has happened in the communications group as well. There was a previous communications committee, but that's all going to be rolled into this one concept of the State Leaders Committee. So I think that that's probably how the NQI work will go, just realistically. But Serena, if you have a different idea of how these are 2 really separate functions, can you weigh in?
Yeah, I think they are the same thing. You know, so it'll just be one committee, however we decide to retitle it. And then, of course, there'll be certain things that we want to discuss with all the state leaders around this topic, you know, in terms of updates and so forth. And everyone will be exposed to that. But there will just be this one committee that will do something around quality, if we want to call it NQI or whatever, that's something that you guys are committed to work on together. And, you know, it sounds like we might just need to regroup in September when we have the breakout call to have you guys really maybe figure out what that is.
Sounds good. Yeah, that answers it.
Okay.
It does. Thank you.
Okay, so are we done with items 2 and 3? Does anyone else have any additional questions or comments on either item 2 or 3? Okay, then let's move on to item 4, State Affiliate Dashboard.
So Serena, Clayton, and I want to do a little exercise because we discussed this. Back in June to try to get all of us to use on a regular basis the State Affiliate Dashboard on our website. So what we want everyone to do right now is log into the State Affiliate Dashboard. I have the instructions here on the slide. So if you aren't automatically logged in right now, please do so now. I'll keep the slide up for instructions. But we want to be able to show you some things on the dashboard and ask you to actually upload some files. So I'll give you all a few minutes, and I will also log in on my end. So if you guys could just shoot me a message in the text box when you've been able to log in the chat box, that would be great. So I have an idea of course, my login is not. Okay, there it goes. Great. Looks like people are logging in. That's great.
This is pretty exciting.
So this is what, if you guys look on my screen, you should be able to see what, you should hopefully see what I see right here. I'll give it a few more minutes. I know Serena.
Wait, so Serena, I ended up on the member dashboard.
Okay.
Remind.
So if you go to resources, there's a drop-down menu at the very end.
Right. Okay. So you might want to make sure that other people aren't on the member dashboard.
Right. So everyone, when you log in, hover over the resources, and there's a state affiliate dashboard option. If you do not see that option after you log in, please let me know, because it should be able to show up if you're logged in. If you're not logged in, you're not going to be able to see this. And again, here are the directions if you need them. And what I would actually recommend when you guys, log in, to click the Remember Me button, and then you should automatically always be logged in when you open this up on your browser. Or also, if you use Google Chrome, have them save the password and the username. Usually something pops up. And so every time you go to our website, the state affiliate dashboard should be one of the first things you see to really drive you to there. Great.
So Serena, this is Kathy, how do you set it up if apparently I've not done this, so I'm going to have to set up a password and stuff.
So have you tried your old user email and password that you had before with us?
I didn't, because I probably wrote it down somewhere and don't remember where it is.
Okay.
Hey, this is Kyle.
Yeah.
Any suggestions?
Yeah, you shouldn't even need to remember your old password or anything. If you just create like a new username using the email address you had in the old website, you should automatically be added into the state affiliate segment. And if not, just let me know and we'll manually put you in.
Okay.
So I think you covered this already. This is Heidi from Illinois, but mine is showing up as a member, not state affiliate.
Okay, and when you hover over resources, do you see state affiliate dashboard listed as an option or no?
Yes.
Okay.
Okay, I'm there. Thanks.
Okay, great. Great. So we'll give
one
more
question, and when I hover over the resources, I see the members dashboard, but not the state affiliate dashboard.
Is this
Same for me, Serena.
Who's this? Stephanie?
Yes,
who else?
I just see members dashboard.
Was the other person Molly? Was that Molly?
Molly Howard from Washington.
Oh, hi, Molly. Is there anyone else who does not see that? Because then we need to ask our database person to flag your email and allow you to see the state affiliate dashboard, because it's protected. So only those people that we have labeled as state affiliates are able to see it. So if you cannot see the state dashboard when you log in, please let me know so that I can make sure that your account is tagged.
Okay, Serena?
And I got Molly and Stephanie Daniels. Is there anyone else who's having problems?
It's not Molly, it's Holly, Holly.
Sorry about that, Holly. Great. So it's been about 5 minutes. So I just wanted to quickly highlight with you all the state affiliate dashboard. There is a forum option. So if you guys have a question you want to pose to the entire group, you can actually do that. If you want to email just state affiliate folks, you can start a forum by clicking on it. Or if there's actually, I don't know, a call to all School-Based Health Alliance members, let's say you want to pose a question to the entire field nationally, you can also opt to click on the members forum and then create a topic discussion. So here's one that Kyle started around the convention. So that's kind of the first highlight here.
Hey, Serena, can you actually walk us through that? Because when I click on affiliates, is there a button to say start a conversation? I'm not seeing that. So I just clicked on affiliates, and when I click on members, it says page not found.
Oh. So you're not seeing what I'm seeing as I'm clicking you guys through here?
No.
Okay.
No, well, same thing for Oregon.
All right. So same thing for Illinois. You know, Kyle is here, so he's tagging this information, I'm sure. But this, from my screen, this is what you should be able to see. So let's say, you know, Nancy had a question about School-Based Health Center award system. You know, she could type in the topic here, write her question, and then actually submit this forum topic, and then, you know, the state affiliates could respond that way. So it's a better way to kind of communicate where it doesn't require me to like send out a mass email to people.
So Serena, what will happen when she launches that? What will happen? Will it just sit here on this page, or will it send us an email?
Kyle, can you answer that question?
When you post a comment, a topic?
Yeah, when you post a topic.
Yeah, I mean, it gets posted automatically. It doesn't need to be moderated or approved or anything like that.
But I mean, for us to see it, would we have to log into this page and actively look for it, or will it send us an email with the question?
When when other people post, that's something that we're looking into. So like right now, it's not set up that way. You would actually have to come in here, but Serena suggested, and we're trying to figure out if there's a way to kind of automatically opt everyone in, so they will get these emails, and then you can opt out if you don't want an email every time somebody posts. So yeah, unfortunately right now you'll have to go in there and look at it to actually see it, but we're trying to find a workaround for that.
So, you know, sometimes on these things you're allowed to set up your own preferences. I'm going to sort of guess that if people start getting an email not only every time someone asks a question, but also every time anybody else answers the question, they might start getting sick of it.
Yeah.
So exactly. I'm wondering if there's some way to do maybe a weekly digest. Like, I do think it's really valuable to have something that comes to us, because if we have to log in here just to see if any of our colleagues have asked a question, I don't think we're going to do that. But if we could get something on a manageable level, or maybe in the scoop, if you could say there's 3 questions, here's what they are. I don't know, again, that's taking it more back to email. But anyway, you hear what I'm saying.
Yeah, yeah.
And it looks like Sarah just posted something. So thank you, Sarah.
You're welcome. I thought the best way to see what happened was to just give it a try. I could see the screens that you were saying, so if everybody refreshes their browsers, you should be able to see that I put up a test forum so that you can see it. And yeah, Serena, that's a great question about how does it function as a listserv? You know, is it going to be email streams? Are they specific to topic? What opt-out options do we have? That's all good stuff to find out.
Yeah. Oh, I can see that you posted something, Sarah, but I can't.
Yes.
Oh, I can't see it though. Yeah.
This is Nancy. The same way I can see that there are topics and posts and like when, but if I click on affiliates or members, I get 404 error message.
Right. Yeah.
All right. Well, we'll figure out those kinks, but I just thought I'd share with you this function.
Can I ask a quick question? So you're getting that 404 error when you're on the affiliate dashboard and you click on the forum button?
No, so if I go to visit forum, I can see, you know, affiliates, members. If I then click on either affiliates or members, I mean, it does light up, but when I click on it, it says, we're sorry we couldn't find that page, 404, page not found.
Okay, okay. Thanks. Yeah, we'll take a look into that. I'm not sure why that's happening for some people and not others.
And then here,
Kyle, I think it's happening for many people.
Yeah, most of us, it sounds like.
Yeah, it sounds like most people, but Sarah was able to get in there and post, so that's interesting. Yeah, we'll try to figure out what's going on there. Sorry about that.
Great. So hopefully we'll get that figured out, but this is a way for you guys to communicate. And it would be my dream that we use the forums as a mechanism to send the monthly scoops versus an actual email that we currently get. But I don't think we're quite there yet. And then just an FYI, oh, I need to go back to the state affiliate dashboard. On the right hand, you can see here we're going to list the upcoming calls. So if you forget what time our next call is or what date the next call is, we have that posted here on the right side. And then we also have a little listing of what our national webinars are like. And then we have this lovely state affiliate library where we have some folders that we may need to regroup. But for example, we have the policy work folder where I'm saving the calls, you know, the call PowerPoint slides and resources. And I'll probably create a folder for the monthly calls, and I will upload the PDFs there. So what Serena and I wanted to do was to do a quick exercise in asking everyone to download a, what did we say, Serena? I forgot. The, oh, I forgot the exact
what you mean is, you mean upload, not download, right?
Oh yeah, upload.
Yeah. I think I was trying to think, what is the thing that we most frequently ask for from each other? And I think it was like either bylaws or something about board.
Yes, it was bylaws.
Bylaws? So, well, anyway.
Go ahead, Tina.
Actually, let me leave it open if somebody would like to call out something that they would like to see other people's, whatever this thing is. Say that now, because we can just, this is really just to practice and then just to make it very practical so that we all actually try to upload something that other people might be interested in. I feel like we ask for bylaws, we ask for state standards, but we already have a lot of state standards, so let's not do that. Sometimes ED job descriptions people ask me for. I think I uploaded a board member description. So it would be useful.
I think we were talking about sharing like one-pagers about our alliances in the February meeting. You know, we all brought our samples, but then we were talking about sharing the actual samples of, you know, like an overview of our alliances.
Okay, let's do that. So like if you have a thing that just describes describing the state organization.
Which folder, Serena, should they put it in? It doesn't really.
Well, I feel like that's a communication example.
Communications example.
Yeah, and maybe can you make a subfolder in there, Serena? Is that easy to do or not?
Another question for Kyle.
But yeah, we can make subfolders in here.
Okay, so why don't, but let's just for now have everyone upload it into communications examples.
All right, so everyone click on the communications example folder and then upload. You put in your name, email, briefly describe what you're uploading, and then choose your file, which will be the About Us, you know, whatever you use to talk about yourselves as a state association, and then hit upload and hit submit. So we're asking everyone to do that now, and I don't know, Kyle, if we can automatically see them populate in here in this folder, but
no, the way it'll work, and I can do this as they come in. This system, and this is something else that we're also hoping to improve, so that you all can automatically just upload your own resources. But basically, Matt, Anna, and I, as the admins of the website, we kind of get pinged whenever anybody uploads something, and then we have to place it in the folders. So I can do that as they come in, but we're hoping to change that for the state leaders moving forward.
All right, so just send me a quick chat when you've uploaded a document, just so I know when we're kind of ready to move on to the next item on the list. And let me know if you're having any issues, or let Kyle know if you're having any issues uploading a document. I just want to get you guys used to playing around with this.
Kim, this is Nancy. Would you upload the one-pager we gave to OSA? And Kim and I are actually in 2 different places, so I'll upload our New Mexico Alliance bylaws too, just for the heck of it.
Okay, I was just going to G-chat you and ask you what you were uploading, so perfect.
So it looks like, Tammy, you just submitted your one page. That just came through.
Yeah, I did, but it is our old one. Our new one, it wouldn't take the extension. It was done in Publisher, and it wouldn't take it. It was weird. So now that I've submitted it, I go back. Now I'm on a page that says, thank you, your form was submitted successfully. But how do I get back to submitting another one? It doesn't let me.
Oh, so, sorry about that. That was a bug that Matt was supposed to be working on. I wonder if he hasn't found a way to fix that yet.
Great. So we're going to give it about 1 more minute, and then I think we need to move on to the next agenda item. Poor Haley's sitting here.
Again.
All right, so I see that Tammy and Nicole have uploaded something. Have other people uploaded anything? It sounds like Nancy's working on it. So
working on it.
Great. Perfect. So now we're going to have lots of cool examples. Let's see.
Easy to go back and forth.
And Serena, can you remind us and maybe hover, because when we were looking at this before, we were realizing that sometimes the file name that we have on our server isn't, like we don't typically put our state in front of everything because it's all our state. So, but it's really helpful to have the name be super descriptive so that you don't have to actually open it to figure out what it is. And then you pointed out to me, Serena, that there's this description where you can write the description of the resource. So I see that for the upload, but when it's already up there, how do you see the description?
Okay. So when I click on this, so I'm clicking on the 20th anniversary celebration slides. It says
Got it. Oh, I see. So at the very bottom, where it says a collection of PowerPoint slides. So that's where the description will show up. So that's our chance to tell people what this is before they actually download it. So that's kind of important just to make this really useful for us. Because, yeah, there are a lot of things there. We're not going to want to like be guessing which one to download and then download it and think, oh, that's not really what we wanted.
Right. How's everyone doing?
I just submitted something. This is Kathy.
Kathy.
And also, Serena, I think, isn't this normally going to be set up where it won't go up automatically, but you guys will have to approve it?
That is correct. So, you know, right now you can't see it, so probably not until later in the day will you be able to see it up here.
Oregon's is in there. I'm adding them in as they come in. I've received like 7 so far, so there's a little bit of lag time, but I can place them in as they come in.
That's great. And Kyle or Serena, when you guys do it, it would be really helpful if you would try to do what you, I don't know if you did this, Kyle, but if you're able to rename them.
Yeah, I'm trying to as best I can, but
yeah,
more information that you can place in the description, you know, that'll be helpful for me to like clean up the names so they're not the exact same as the file name.
Right, yeah, I think that would be really helpful, like if there was some standard, like right now, if they could all be called, like whatever, something that helps us see these files all as one cluster. If they're in a folder, that helps a lot. But I think one of the problems with the wiki was that there was just so much stuff. It was kind of like a hodgepodge of stuff, and it was a little bit difficult to navigate through it. So I feel like that is helpful if you can make it, like either have them in folders or have consistent naming so that we can get that, okay, these are all examples of this particular thing.
Mm-hmm.
Well, thank you all so much for sharing these communications examples and uploading one-pagers for everyone so that you guys can see how everyone else is talking about one another. And now I think I'm going to hand over the presentation to Haley, unless there's one last thing that you want to talk about regarding the dashboard. Nope, we're good. And Stephanie and Holly, I will follow up with you all about, the login issue.
Sounds good. Thank you.
Great. So now I'm handing it over to Haley. Thanks, guys.
Hi, everyone. This is Haley. I'm going to give you 2 updates on this afternoon. The first is on a new resource we've developed called the SBHC Literature Database. I'm going to do a little demo and show you what it is, how it works, how you can use it, and invite you to provide feedback to us about the tool. And then I'm going to also provide an update on the standardized performance measures and progress we've made in that work. So in the past couple of weekly updates, we've shared a little bit about this SBHC literature database. So if you come to our website now, I'm going to show you how to use it, and you click on the Resources tab, an option will be SBHC Literature Database. This is a resource to try and help empower the field to use and be aware of all of the peer-reviewed literature about school-based health centers to improve and strengthen knowledge and understanding and dissemination of work about our field. I think we are hopeful that this will help reduce the amount of work that has to be done to say what articles have been written about school-based health centers and access, what articles have been written about school-based health centers and inappropriate use or diverting inappropriate use of emergency departments, those types of questions. So what we've done is create this database that allows you to sort the articles by a primary and secondary topic area. You can also sort them by grade level focus, the year they were published, the first author, last name, and citation. And then you can view the objectives, a summary that we wrote of the objectives, findings, and connect to the abstract of the presentation. So I'm going to go to the website now and show you how it works. Like I said, you click on Resources and you go to SBHC Literature Database. If you want to see the types of primary topic areas that you can sort the articles by, there's a list here. So you'll see it's academics, access to care, asthma, behavioral health, a variety of topics. The secondary topic areas are a little bit more specific and get to the meat of what the article is addressing and allow you to get a bit more specific. And so if you scroll down, then you can see this table, which includes a list of all of the articles. There are about 150 articles now in the database. People have already been sharing information with us about additional articles that they wrote or they are aware of that they wanted to see added to the database. So let's say you wanted to know which articles have been written most recently about school-based health centers. You can click on Year Published, and it'll sort the articles by the year published. So you can see all of the articles that have been written about school-based health centers in 2015. If there's an author or colleague of yours who's written articles and you want to sort the articles to find the author, if you know the author's first name, you can sort that way. You can click in the search box as well. So let's say I was interested in the articles written by Claire Brindis. If I type Brindis into the search box, it's taken its sweet time this morning. but it will pull up, as you can see, all of the articles written by Claire Brindis. So go back. And then here it allows you to sort by the primary topic area. So if you want to see all the articles that have been written about academics, and then you can look by secondary topic areas such as absenteeism. You can look at that at that topic area. If you're interested in learning more about any of these articles, you can hover over more and see the objectives, the finding, and a link to the abstract. So this will be a link to PubMed where you can read the abstract. And if you're interested in downloading or purchasing the article, you can go about doing that once you've linked to the abstract. And then if you have articles that you want to share with us, we encourage you to click here, and this will send an email to me. And we will be updating the website, the database quarterly with all of the new articles that people share with us that they are aware of or have learned about related to school-based healthcare. So we're inviting people to provide feedback on the database and tell us how we can improve it. So if you're interested and you want to provide us a bit of feedback, I shared the survey link in the Scoop yesterday afternoon. So if you have any suggestions, there are 3 questions in the survey. If you have any suggestions for how we can improve the literature database, if you want to share how you could see yourself using the literature database, and if you know of any additional articles that we can add, please share them with us, even if you only know a couple of, even if you just know the title of the article, or you say, I think that Serena Clayton's written an article. I don't think it's up here. We can use that as to energize the search of the literature to see if anything's been written. Does anyone have any questions or reactions?
Haley, this is Sarah from New York. I think this is fantastic. I happen to love research, and when research is made easy, this is a lovely version of a literature database. I think you guys did a great job with it. I want to know if it would be all right for us to link to it, knowing full well that is this state affiliate or is this member only?
No, this is for everyone, and you can absolutely link to it. The purpose is to prevent people from having to do the legwork of going through databases. So absolutely, the point is disseminating it as widely as possible, and we would be delighted if you link to it.
I think I'd like to not only put it on our website, but in our next e-newsletter, I think I'll highlight it, just because I know that there are a number of larger organizations here in New York that they do a lot of their own research, and I think this would be a great link for them.
That would be wonderful. Thank you so much.
Sure. Yeah, Haley, this is Serena. I want to ditto that. It's really great. I've been wanting you guys to do this for like 10 years, and I realize it's a huge undertaking, but I feel like it's exactly the kind of thing that makes no sense for us to all be doing separately in our own states, trying to hunt down these articles every time we want to make a fact sheet or write a proposal. So this is hugely, hugely helpful.
Great, thank you. That is a hope that when you're writing your grant applications now, that this will make it a little bit easier. And when people come to you, all the time people come to us and say, I need to go to my state legislator or my senator and tell them and advocate and tell them, about school-based health centers and what they can do and why. And the peer-reviewed literature is often, it might not be the make or breaker in the decision making, but it's certainly a powerful tool to have to be able to describe, the history and what's been written. So great.
Hi. This is Nicole from Maryland. Just along those lines, is it possible that you all could give us like a tweet about it that includes a link, a tiny URL that we could distribute that way as well?
Yeah, I definitely can put something together and send it out to everybody in next week's scoop if that'd be helpful.
Yeah, that would be great. That would be great. Thanks.
So, and I guess the best help that you can, or one of the best ways you can help us is just as you see articles come up, or if you're looking through this and realize in your literature reviews that there are articles that you don't see in this list, please share them with us. We will add them.
Haley, one other thing I want to add is that I always look to you guys to vet these articles. So I really want to encourage you to only put the articles up here that you really feel confident in, that you really feel like we should be citing. You know, that some of us don't have time to do this, some of us don't have the background to really be able to evaluate the quality of these articles. So I feel like in some ways less is more. Like I would love to see this just be the really good stuff that you feel good about us using.
That's a great point. Previous to this, we had top 25 articles that members of the Evaluation and Quality Panel recommended to School-Based Health Alliance. Yeah. The challenge is that it was it was done in 2011, and then it was only as fresh as 2011, and so and it was the expense of having something more robust that really showed all of the literature. So I'm trying to think through the best way to do that vetting process.
Well, so let me just say though, Haley, I'm not advocating for the top 25 because that's pretty limiting. But I would just say, you know, if somebody recommends an article to you, I would really be looking to you to look at it and say, yeah, this is really a decent methodology. This is a robust finding. This is worth putting up there. Or it also takes liberty to say, this is just really not, like, you wouldn't cite it yourself. You know, if you don't feel comfortable citing it yourself, then don't put it up there. I'd like to know that everything up there is something that is you know, robust enough that we could cite it in good conscience. Because honestly, we're not going to go buy the PubMed articles and read them. That's kind of what's going to happen, right? I mean, we're just going to read the abstract, and so I think part of this is like we're trusting you to have made a good call on this. But I'm not advocating for the top 25. I think this is way better. This is great.
Okay, great. That's helpful. I'm relying on... Sorry, go ahead, please.
Sorry, this is Lori from Oregon, and I'm wondering along those lines if it would be possible to incorporate the quality rating from the recent CDC censuses for the studies that they included as one of the ways to determine the quality of the studies.
So can you, what do you mean by CDC censuses?
Well, so what I'm talking about is the recent systematic review that was sponsored by the CDC. There was a presentation at the National Convention, and it's part of their prevention services.
Yes.
And so they recently published this systematic review that includes quality ratings of the literature. And so I'm just wondering if we may want to consider including the quality ratings of specific studies that they included in their systematic review.
Lori, that's a great question, and this project builds on that systematic review that they did. The challenge is that they only looked at articles from 2000 to the present, and we wanted to extend it from the earliest literature we were aware of to the present. We could put a star next to the articles that were a part of their systematic review, and in order to identify which articles those were, they used the findings from these articles to determine, you know, the findings that were reported reported in their report and will be reported in the article that they will put out. It's a great idea. We'll look into it further and think about how we can align the two a bit better.
Okay, thanks.
All right, thank you much, Lee, for all this feedback. If you want to provide additional feedback, we encourage you to do so. We're going to try and write some blogs about the tool just to disseminate it to the field and try and get people using it. Our next blog is going to focus on some of the gaps in the research and how having a tool like this allows us to identify where there are gaps in areas for new research. So if you want to provide any feedback in this survey around where you feel there are gaps in the research and where you would like to see it, we would love to use that as some background material as we develop this next blog. And if anyone wants to co-write a blog about this tool, we'd be very excited for that as well. So unless there's any other questions, I'm going to move on to giving a quick update on the national performance measures. So just quickly, as many of you know, and several of you have participated in since April, we have invited all of you and been working with stakeholders across the school-based healthcare field to come to consensus on a set of national performance measures for the field. We have used something called the RAND UCLA Delphi method, which is a method used to engage groups in consensus processes, and it's a series of rounds of scoring of performance measures and refining definitions, and now in this final third round, prioritizing top measures. So rounds 1 and 2 are complete. Round 3 is currently open. So people were, all of you were invited to participate, but then after round 1, you were only invited to continue to participate if you participated in round 1. So if you're participating in the process, we encourage all of you to score your top measures by next Wednesday, the 19th, and we will be finalizing this initial set of core and stretch measures and announcing them in September. So just some quick observations. We had 86 participants in the first round. 72 of those 86 participated in the second round. We hope to see 86 participate in round 3. Round 3 is really the easiest. Maybe it's the hardest, but it's also it's the quickest. If you have a gut instinct, it should be rather quick. But what we have enjoyed and really see the value in this method is that a lot of different stakeholders have been involved, representing different perspectives and helping us build consensus on a set of measures. So as a part of the process, we ask you to share comments and insights on the advantages and disadvantages and concerns with each of the measures, and we've organized those as items for consideration for each measure. So I'm going to share with you very briefly what we found as the findings in the second round of scoring. The second round of scoring, the results were very similar to the first round. The same measures emerged as being scored the highest. So depression screening, annual risk assessment, immunizations, well-child visits, STD and chlamydia screening and BMI assessment, and nutrition and physical activity have consistently, those 6 have consistently been at the top of the list, with the others not far behind. In the second round, we asked participants to score the measures, to score stretch measure data collection strategies. So there were measures that were included in round one that felt that they could be grouped by a specific data collection strategy. So, for example, we are proposing that school-based health centers would use a standardized SBHC client survey that would include domains such as patient experience with care, their health efficacy, their health literacy, their perceptions around access due to the location being of the care being in the school. Then a separate strategy is an SBHC policies and procedures survey. This data collection strategy brought together all of those elements that are related to policies and procedures. Things about referral completion, the integration of primary care and behavioral health, care coordination policies and procedures. And these are all in the policies and procedures category right now because there's not a validated standardized measure that really helps us get to the outcome data related to each of these policies and procedures. So it's our first step in diving into this. And the third is a client disposition log. That would be an approach that would allow us to track student disposition after services, so tracking seat time. So were students sent back to class, were they sent home, or were they sent to the emergency department? How much classroom seat time was saved, and whether we can make connections to, money saved by the school because of the school-based health center being located there and kids being able to access care in those settings. So here you see the scores on those three approaches, and in this next slide you see how the different domains that will be included in each of those approaches score. And again, there was a lot of consistency from round one to round two in the domains that rate quite high within each of these approaches. So just quickly, some changes made for the measures for round three. Based on the feedback from round two, most of the proposed core measures are now standardized to align with measures used by national quality initiatives. So we have the ability to compare our performance with other healthcare providers. For those of you who are participating in the process, we made some slight adjustments based on feedback for the measures that were proposed in round two, and then found that equally as many comments were included as to why we should go back to the definition that was proposed in round one. And the decision was therefore made to align the measures with national quality measurement initiatives so that we have this ability to compare and be using a standardized approach. We're struggling a little bit to define the asthma management measure based on sort of the capacity of SBHC providers to document data related to clients with asthma and whether it should be defined as documentation of an asthma action plan or those who are identified as having persistent asthma and were appropriately prescribed medication. The first measure is a measure that's used by a state government office. The second measure is a CMS meaningful use measure. But if this measure rises to the top as a part of this Delphi process, then we will use the Learning Collaborative as an opportunity to really refine and fine-tune this measure and figure out the best measure for our field. So what are we trying to achieve in round three? We're asking you to prioritize your top 5 core measures and prioritize your top 2 stretch measure approaches. And the results from these scores will form the initial set of voluntary performance measures for school-based health centers. When you're scoring and prioritizing your top measures, we encourage you to review the items for consideration in the instructions that were shared with you. So we include the items consideration from rounds 1 and from round 2, as well as the scores. And this information is really interesting to read about some of the considerations that we should have as we get stuck into defining these measures and what we should be thinking about. So reminders and deadlines, please submit your responses for round 3 no later than next Wednesday, August 19th. And then our next steps are that we will review responses from round 3. We're going to finalize and announce an initial set of measures in September of 2015. We'll be scheduling a webinar to announce the measures to the field. And that we will be starting a learning collaborative in the fall of 2015 when early adopters will adopt and document and report measures to the School-Based Health Alliance. That was a lot of information I just shared. Does anybody have any questions or reactions to anything related to the selection of performance measures?
Haley, this is Serena. My question's not about the selection of the measures, but I just wanted to make sure that I'm tracking everything correctly. The Learning Collaborative that you talked about that's going to pilot the measures, that's a coin that you already got applications for?
Yes.
Is that correct? Okay. And so can you tell us how many sites you've selected? Have you finished that yet, and who they are?
No, we can't tell you yet because we are all of the data. We've sent the applications out for external review. Staff involved with the project are reviewing the applications as well. Okay. And we will, internally and externally, those scores on those applications are due today. We will be meeting early next week to discuss them. And I believe it's August. I believe that it's August 17th. I might be off by a day or two when we'll be announcing who the winner, who will be participating in the initiative. But we will absolutely share that and disseminate that widely.
Great, thank you.
Sure. Okay, thank you, everyone. I'm going to turn it back to Serena Clayton to finish off the call.
Okay, thanks a lot, Haley. So I think this has been a very productive call. I'm excited that we all logged on and tried to troubleshoot our issues getting onto the dashboard and practice uploading and everything. Does anyone else have any last comments or questions or requests regarding future calls or topics or anything like that? Okay, then I'm going to officially end the call and look forward to talking to everyone next month.
Great.
Thanks, Serena. Take care. Bye-bye.
Bye-bye.
Serena.